I'm like, I don't have time to read everything. I can't study 2 years of medical school back in a couple of months. It's not possible. So there's a way around this, right? This is why I'm showing you these techniques. We have SLE, 3 letters. Forget about these for now. PAN, 3 letters. IGA, 3 letters. Post-strep GN, now it's infectious because they changed the name. It used to be post-strep. As you know, staff can do the same thing. Calls up and says, hey, I want to change the name. I don't want post-strep. I do the same thing too. So now they make it infectious. The name is infectious. It's both staph and strep. Works better for us because it's 3 letters. If you can, I don't want you to memorize this because you don't have time to memorize. There's a lot to memorize. You won't remember it. If you remember the techniques I show you, yeah, you have a better chance to remember. Many of you know the techniques already because you've been here for a little bit, right? So type 3 is 3 letters. Boom, 3, 3, 3, and 3. Now you're like, Stavros, how about this? All right, well, there's a little, you know, obviously separated one because this is different, but you can remember RA and RA, rheumatoid arthritis and reactive arthritis. By the way, reactive arthritis, there's a triad. I want the triad in the answer choices here in the chat. If you can remember the triad to reactive arthritis, that'd be great. I like to hear that and see that. So now we go back. We say, okay, we could take out IgA. That's a type 3. Boom, just take it out because you can't have 3 answers, right? PAN, that's also type 3. And then post-strep. Yeah, Stavros said post-strep is like staph and strep. They changed it to infectious, IgN, whatever. Boom, out. So automatically, can't see, can't pee, can't climb a tree. I love it. You know what the problem with that is? You guys are all right. But when you answer questions, I've seen people get it wrong because they know can't pee, can't see, can't climb a tree. And then when they see scenarios, which you will see many with us, you acclimate the terms like arthritis, conjunctivitis, urethritis. They get tricky on writing the words in the scenario. So I love that you know the triad. Congrats, guys. Now, when you do MSK, and you'll see these questions with me, you'll see how tricky they are. But with me, we're going to get through it together. Yes, yes, awesome. So now we're down to 2. I don't know. We have AIHA, and we have GVHD. Now, GVHD is a nice, I like it, because whatever I say I like is not because I think it's fun. I'm a test taker and a test writer. So if I tell you it's fun, it's because I know I could probably write questions on it and get you all to get it wrong. That's my purpose as a test writer. As a test taker, I do the opposite. I hack the system to make you guys pass. So I'm on both ends, actually, to show you how to pass the test, right? Kind of cool. So when I see GVHD, you're like, what example is that? It's type 4. It's easy, 4 letters, GVHD, type 4. Now, type 4 is delayed. I suggest that you should know what direct cell cytotoxicity is versus inflammatory reaction. One is CD8, one is CD4, because they could ask you a simple question and you know it's delayed. You know it's like TB or delayed. And they want to ask you, well, in direct cell toxicity, what CD count is it? Versus the inflammatory reaction, what CD count is that? Don't memorize, don't write it down. As you watch my sessions and you jump on and you're active here, which I love, you'll start understanding how to consume it all, right? So GVHD is 4. What else is 4? Well, contact dermatitis, GVHD, the word dress, which is actually pretty cool. It's a summary of this. It's drug reaction, DR. E is eosinophilia, systemic symptoms. This will never be on the test, but if it is, it pops up often, but it's never the right answer. That's what I wanted to say. You need to know what this means because many drugs can cause that. So you'll see that on your step 1 in the future, but it probably statistically won't be the right answer, but you should be aware of it because it's offense and defense. Don't assume you're going to walk in and answer every question like this. It doesn't happen.